Good evening, everyone, and thank you for joining us. I'm Kat Porterfield, and I'm a candidate for House District 99, and I'm honored to be your host for this evening's important conversation: how the recent federal budget cuts and other Republican measures are impacting our community now and in the future. First, I want to provide a few comments on how this session will work. We're going to record it, and I'll be providing a summary on the high-level impacts of these cuts. After the presentation, we'll take questions in the chat and then have a discussion with my colleagues, Cheryl and Liz, about how we can work together to elect the three of us to the House, along with Abigail Spamberger, Ghazala Hashmi, and Jay Jones. Together, we are the first line of defense against these harmful Republican actions, and we are the path to turning today's challenges into real victories for the people of Virginia Beach. Tonight, we will cover a few of the most significant areas that directly affect the everyday lives of us living in Virginia Beach and the environing areas, specifically the negative impact of the budget cuts on affordability and accessibility to healthcare services, education, K through 12 public education and higher education, and the consequences on after-school programs, teachers, and education resources, and our ability to prepare for and protect ourselves and our property during storms in the face of cuts to FEMA, NASA, and NOAA, agencies which provide early warning, forecasting, and emergency response. And food security, with cuts to SNAP, which directly benefit children and seniors, as well as low income working adults, and the indirect impact on U.S. businesses, including farmers who provide the goods and services in support of programs that feed Virginians and the world. We need to recognize the real consequences of decisions made in Washington and in the Republican governor's mansion not to take action, consequences that fall on everyday people right here in Virginia Beach. That's why it's so important to elect candidates who truly care about our community, who will make sure your voice is heard in Richmond, and who will work to both manage the harm and build something better for our future. I want to welcome my colleagues, Cheryl Smith, who is running in House District 98, and Liz Richardson, who is running in House District 100. We will have the opportunity to talk with them about these issues in the second half of this discussion. I would now like to introduce our guest speaker, Dr. Andrew Kavord, PhD, a well-respected budget consultant with deep expertise in both federal and local budget policy. He has conducted extensive analysis of the new federal budget's deep cuts to Medicaid, public education, science, and food security, and will break down what the budgetary impact means for you, your family, and your community. Welcome, Dr. Bavord, and let's begin with a quick overview of the administration's economic track record and then the magnitude of budgetary cuts.
Welcome, everyone. Thank you for having me. And
Next one.
Kat, you were going to talk. Well, this is the introduction Kat just kind of gave, covers what we're covering. So that kind of summarizes it. Let's go to the next slide. I'm going to try to, and I think to set the stage for what we're going to talk about, there's this myth out there that somehow things were so great during the Trump first term, and we're just going to go back to those great things. So next slide. The truth is not so great. First of all, Trump was fiscally irresponsible. The big tax cuts they passed in 2017 blew out the budget deficit even before, the big red thing on the right there is COVID. And we all understand why we had to run a deficit during COVID. But before COVID, you can see the deficit had gone up almost 50% from 660 to $984 billion. So Trump is just continuing his track record of fiscal irresponsibility. Next slide. And just, look at the economic growth. Trump's growth record and growth was literally the worst of any president since Bill Clinton. So just to set the stage there, don't let them talk to you about how great things were under first term. They really weren't. So next slide. Now, what we're going to talk about tonight is kind of a two-front attack on our fiscal responsibility and then on the programs that make America work, literally work well. The first, in the pie chart here, if you know about the federal budget, there's two kinds of funding. There's what's called discretionary funding, which is in the dark blue. It's defense and non-defense, about $1.7 trillion. And that's the annual funding that's passed through appropriation laws. And so every year there's a struggle over how do we pass the appropriation laws to fund the coming year. And that's going to be hitting ahead in the next few weeks as because we don't have appropriations in place to start the next fiscal year, which starts October 1st. Okay, so what the Trump administration is doing on discretionary spending is they're gutting non-defense things like, the park system, the every education programs, health programs, research programs, and he's boosting defense. Okay, so that's one thing we got to talk about, the attack on discretionary spending through crazy appropriation cuts. The second part is what we know is referred to as mandatory. Now, mandatory spending is where Congress passes a law that sets conditions under which people receive money. And the classic example of that is Social Security. And you can see in the chart there that Social Security in 2023 was $1.3 trillion for Social Security payments. Then there's Medicare and Medicaid and other mandatory things like retirement for military and civilian federal employees. And the thing about mandatory programs is that once Congress passes a law, that those programs stay in place until Congress passes another law. And so when you've heard this summer about the big, beautiful, ugly bill, that is Congress using something called the reconciliation provision, which allows Congress to pass these bills without a Senate filibuster. They dramatically changed Medicaid and other mandatory programs, including taxes. Taxes are considered mandatory because once you pass a tax cut, it stays in effect as long as the law says so. So what we're going to talk about here is what happens with discretionary and what's happening with mandatory through the big ugly bill. Okay, next slide. Now, I know this is a little hard to see, but this document in front of you, I wanted to put it up here because this is the actual document that President Trump used to summarize his cuts to discretionary programs. And I wanted to put the real thing up there so you didn't think like I'm making it up. I'm not making this up. And you can see in here, cutting education by 15%, HHS by 26%, HUD 43%, Interior, Justice, Labor, of course, foreign aid, EPA 54%. So you can see there's massive cuts to all kinds of discretionary programs. And their contention, which is false, is that these cuts don't matter, that they won't impact people's lives. And what we want to make sure you understand is that they do matter and they will impact people's lives. Next slide. So let's start with tax cuts. Now, this is, again, another complicated slide, and these slides are complicated because it's a complicated issue. Bill that they just passed. It's I think it's 870 pages and it's really complex. But basically what's going on with their tax cut is they're giving 75% of the tax cuts are going to the top 40% of households. And it's through things like business tax cuts, an extension of the 3% income tax rate, a lot of business taxes. Where the lower end, there's a series of tax cuts that are purport to benefit the lower middle classes. And in some cases, to be honest, they do. But what we're going to show later is that these benefits are really kind of a sugar high to try to get people to vote for Trump for the Republicans in 2026. And those benefits do not overcome the harm. So the next slide. And one thing to remember here is that our tax system is monumentally unfair. And one of the things that the Trump program does is it perpetuates outrageously low taxes for the very, very wealthy. Now, one reason they're low taxes is they don't count gains until they're realized. So when Jeff Bezos' stock goes up, he doesn't have to pay taxes on that because it's not, quote, unrealized. But that's really an increase in wealth, no different than, you going out and working and earning some money, or me, giving a lecture and getting some money for it. And if you look at their tax rates, they're insanely low. And this study was done by ProPublica, and it's an old study, but there's nothing to believe that this has gotten any better. So, like Elon Musk back, when he was only making $13 billion or $1.5 billion a year, was only paying 3% of income tax. Now he's making far more, and you can bet he's paying less. So that's the key thing to remember, is that we have an unfair system. And maybe the worst thing that their tax program does is it perpetuates the unfairness. Next slide. So it's really a con, right? And so
Oops.
this slide here is what we're saying is, what is the impact of their program on your personal income and the economy at large? Well, there's some tax cuts that are going to make you a little bit of money and maybe goose the economy a little bit. But that's got to be set against some things that are going to drag down your income and hurt the economy. Number one is inflation from their tariff program. And it's important to note, remember what Trump says he's going to do is he's going to artificially lower the interest rate. And that will lead to not only higher inflation, but also higher interest rates. So people are going to be paying more for their mortgages and their car loans and stuff like that. We also know that the program is going to lead to higher healthcare costs. It's important to understand that our healthcare system, as complex and messy and really irrational as it is, everything's interconnected. So if you pull money out of Medicaid, that's going to show up for you in higher medical costs, which will lead to higher insurance premiums for you, assuming you have private insurance through your job or something like that. Everybody suffers if some suffer. That's something we need to understand about Medicaid and healthcare policies. And we can also say, look what's going to happen when they cut FEMA. That means the risk to property damages goes up, which means higher property insurances. And then there's going to be job losses from all the firings and the chaos and the tariff impact on the supply chain. All these things are going to drag down the economy. So Trump wants you to look about two things. He wants you to look at yourself and no one else, and he wants you to only look for today. He wants you to be selfish and short term. And if we're asking you as Democrats to think about yourself over the long term and think about others, because that's the real impact of their program. Next slide. So let's go into healthcare a little bit. What they're doing with Medicaid is they're a little bit clever, is they're trying to push off most of the pain till after the 2026 election. So there's a series of Medicaid provisions we're going to talk about in the next slide, but the cumulative impact of these accelerate over time. So Virginia's going to lose $26 billion out of the Medicaid revenue, which over 10 years. And hospitals, remember, hospitals have to provide medical care to anyone who comes in needing medical care. And so if they come in and they've lost their Medicaid, the hospital can't say, oh, sorry, you don't get service. They have to treat the people. And that means the hospitals will continue to incur the expenses, and sometimes much higher expenses, because you're not paying for preventive care, you're not paying for treatments, and you only pay for acute crisis care, which, as you know, for medical is more expensive. So this means that over time, increasingly, hospitals are going to have to shift the cost to you, and you're going to pay through your health insurance programs. And so that means the impact starts now with increasing healthcare costs. When hospitals have less revenue, they have to cut services. We may see some hospitals closing facilities, and some healthcare providers may lose their jobs. So this is a big impact. Next slide. Now, this again is a busy slide, because what they're doing to Medicaid is not simple. It's a series of different provisions that their goal is to reduce Medicaid expenditures by reducing enrollment and reducing payments. But the way to get at this is to talk about the four groups of people that get Medicaid in Virginia. So you can see as of June, there was about 1.8 million Virginians on Medicaid, but they were broken into different groups. They're the aged, the blind, and the disabled. And they're going to lose some important programs. There was a Medicaid program that paid for the copays for Medicare, and that's being delayed. They're putting caps on payments to nursing homes, which is, again, if a nursing home loses Medicaid revenue, they got to make it somewhere else. So non-Medicaid patients or residents may have to pay. They're putting increased home equity limits for Medicaid, which is actually a good thing. It slipped in there somehow. And then the moratorium on staffing standards for nursing homes is putting elderly people at risk because they're not going to have the staffing, the nurses, and the aides to take care of them. So there's kind of an immediate attack on aged, blind, and disabled. But low-income adults and children, they're doing a couple sneaky things. They're reducing the retroactive coverage from 3 months, because now you're covered for 3 months prior to your application if you have some medical bills, to 2 months. So that's hurting low-income people. But the big thing is they're establishing the work requirement for parents with children over 13 years old. Then the ACA expansion. That's the people who work, but they but don't make a low income, and so they still need Medicaid. And here again, they're reducing the retroactive coverage to only 1 month. They're putting in a work requirement, and this is immediately. They're requiring copays, and these are poor people that may not be able to afford the copay. So they say, and then the CHIP program, which was for children, they're establishing work requirements for parents with children over 13 years old. Those are the specific things, specific ages, but they're also going after things. They're attacking Biden had worked hard to make it easier to apply for Medicaid, so they're stopping that. They're making eligibility determinations every 6 months instead of once a year. Their hope is to drive people off the rolls. And that's what's happened in Georgia and in Arkansas, I believe it was, that where they actually tried these programs and eligible people were getting kicked off. And then they're doing emergency care for immigrants, reducing that, and they're prohibiting payments to organizations that provide family planning and abortions. So the Medicaid is kind of a series of provisions that hurt Medicaid that they hope will result in fewer people being on Medicaid, and that's how they'll save the money they require. So next slide. So let's try to make this how it's going to impact on your committee. So the Kaiser Family Foundation estimates that there's going to be an 18% reduction in Medicaid for Virginia over time. And so roughly that means that the Medicaid revenue for hospitals is going to be reduced by 18%. And Centara Health, which covers the hospital, which is the hospital in your area, got $1 billion in Medicaid revenue. And it's in their financial statements. And they stand to lose $180 million in Medicaid revenue per year. And that means, and just for context, their revenue was $12.9 billion and their operating income was $440 million. So that's going to have an impact on your hospital in your area because they've got a $180 billion hole that they're going to have to plug either through, reducing services, curtailing staff, increasing the fees they charge to make up that revenue. And so you can expect that whether or not you're covered by Medicaid, your costs are going up for everyone. Because healthcare, it's not something that no person is an island. We're all interconnected. And if you reduce the revenue for some, it impacts all of us.
And just for a second, we have a local physician we were speaking with, and she was really concerned about older adults who need memory care or nursing home care and their options for accessible and safe care. Are they going to have those options? They're going to be or certainly fewer, right? And also about patients on Medicaid and Medicare paying more for the prescription medication unless they purchase some augment to their policy
Well,
that allows them to get the. We're talking about people who don't have money to begin with, right?
yeah, so there's lots of things to tease out here. And here's the key thing, though.
Mm-hmm.
The state has a lot of leeway in how to deal with these issues. And it's going to make a huge difference whether Abigail Spanberger and the 98, 99, and 100 are in there trying to figure this out than the Republicans. Because the Republicans' goal is going to be to maximize the cost savings, which means minimizing coverage. And I'm pretty confident that Kat and Liz and Abigail are all going to be trying to maximize care and coverage for people. And that's a huge difference. So that's why we have to win this election. It's huge. There's a myriad of details in this. And I'm very confident that Abigail Spanberger will put together a team working with members of the General Assembly to do the right thing as best as possible. And of course, the ultimate solution is we got to get our national government back, right? Because Abigail and you all will be in harm reduction mode, but the cure has to come from the national government, which means in 2026, Jan Kiggins has to go, right? Because she's part of the problem. But that's next
Well,
year.
can we talk about the cure for a second?
Yeah.
Andy, because Winsome Sears believes she has the cure. And it doesn't call for more cowbell, but it does call for her using the rainy day fund to cover all of these cuts. And she's suggesting we have 4.7 billion in this rainy day fund. Okay. So 4.7 billion, you're the economist. Unless my math is bad, can you clarify how bad hers is?
Well, okay. First of all, I used to be a long time ago deputy budget director of DC.
Mm-hmm.
And it's important to have rainy day funds because the bond rating agencies, if you start using rainy day funds for operating expenses like the Medicaid problem, they're going to punish you and you're going to pay higher interest rates for the bonds that we need to do to build schools and roads and things like that. Second of all, okay, let's take, I think that there's at least $1 billion hit to the Virginia state budget from all kinds of things. We'll talk about SNAP. That's $250 million. Trying to plug holes in Medicaid. We have to buy new IT systems to do this twice a year verification, to do all these other things they want to check on whether people are dead or whether they're undocumented immigrants or things like that. So there's going to be a huge revenue impact, expenditure impact on the Commonwealth. And if we just use the rainy day fund, it's going to be gone in a couple years. And so then what are we going to do then? What are we going to do in 3 years when that one, because it sounds like a big giant number, $4.7 billion. That will go quickly if we don't manage things properly. And I don't think we've seen a record from any Republican for efficient management of financial in a responsible, effective way. That's just not in their DNA. They just don't do that either at the national level. And we remember the mess, from previous Republican administrations that, people like Governor Kane and Governor McAuliffe had to come in and fix their messes. So I think the only fiscal responsible thing to do is vote Democratic.
Oh, the Democratic Party did the math on this one, Andy. 4.7 billion in the rainy day fund. That's a $29 billion decrease in federal Medicaid spending over the next 10 years. So it equates to 16%. So the 4.7 billion only would cover 16% of our shortfall.
And my only point with that, though, is there's a lot of other things that we're going to have to use the rainy day fare, the building those new IT systems, SNAP programs, education. And oh, by the way, teachers deserve a pay raise. And oh, by the way, we have facilities shortfall for our schools throughout the Commonwealth. So, that's just, a typical one-liner. Oh, yeah, it sounds good. but it's a con just like the rest.
Well, I hear other Republicans out there running on using it to get rid of other things like the personal property tax. So they all have designs on this rainy day fund, and there's just not enough in there for them to do all the things that they're claiming that
and
they would like to do with it.
and if you get rid of the rainy day fund, you're not going to be able to sell bonds.
Hmm.
That's a problem.
Well, yeah,
And
you hurt your
that
credit rating
means you
here.
can't do
Mhm.
anything on your roads and your schools and things
Mhm.
like that. So, okay, any other comment? Next slide. This is also important is they changed the Affordable Care Act in ways that may, and I list the provisions there, and we don't have time to go into each details here, but basically they're making it harder for people to get health insurance through all these changes to the Affordable Care Act. And the House Democrats in the Budget Committee estimate that these provisions will cause approximately 135,000 Virginians to lose their health care. And those lost insurances will happen sooner than 2026. That should start happening pretty quickly. So that's a lot of people are going to lose insurance. And of course, when you lose insurance, that's more lost revenue to hospitals because that's people who coming in needing care who aren't going to have insurance to cover it. So there's multiple problems here.
Mhm.
It's not simple. It's Medicaid's a big problem, but the changes to the Affordable Care Act are also a big problem.
Mhm. Can we talk a little bit about education? I
Yeah,
think
let's
everybody in this room is really interested to hear how these cuts are going to affect us.
next slide. I think. Well, can we just yeah, we'll get to education in a minute. I'm sorry, but I just want to also the cuts. Now, again, I put the chart, which you can't read on the right. That's their chart. I didn't make this up, but they're cutting the NIH by $16 billion. They're cutting aid to children with families and communities by $7 billion. And that's a real massive cut. And it's going to impact food safety, but it's also going to talk about the ability to respond to national health emergencies. God forbid that we have another, virus epidemic. Um, and there's stories already in the media about people getting pulled from cancer trials who are losing life-saving treatments because of these cuts. And the future, cancer, we've made some progress in, and there's lots of promising research, and they're bringing it all to a screeching halt. Things like Alzheimer's and many other programs. So I just want to highlight that. Next slide. And now we're into education. Okay. Now, they're really gutting education, and I couldn't show all the cuts and these are cuts that the president proposes, and it's very important to recognize that all Republicans say they support this president. And it's perfectly fair on the campaign trail to ask them, hey, do you support gutting the Office of Federal Student Aid? Do you support gutting a National Institute of Health? Because your president does, and you can ask them like what these cuts are doing. And so it's cuts to Title I and Title IV that support teacher development and after school programs. And also remember, Medicaid is a funding source through K through 12 education. It's an important source. So these are going to have real impacts on your school system, your local. For example, you look at Office of Innovation and Improvement. It's this relatively small, only $1.6 billion in 24. You're saying, what is that? Well, that's all the statistics and all the innovative ideas that we use to improve education, because it's not feasible for each state to do this on their own. We can best collect statistics at the national level, and we're giving that up, and many other things with their cuts on the Department of Education's proposal. Hopefully, like if James Walkinshaw, when he's in Congress, he can vote against these, and maybe somebody can stop these in Congress. But this is what the Republicans want to do. Next slide. Now they're doing some stuff with student aid. Pell Grants, which is the funding for poor students to go to college, they're cutting 30% of that was proposed in the president's 2026 budget request. Again, they want to cut Pell Grants. And they're making student loans, and this is done through the big ugly bill, because they're reducing loan subsidy costs by $270 billion from 25 to 34. Well, that means they've got to get students and people paying student loans to pay $270 billion more dollars. And they're doing that by increasing borrower costs, by extending the income loan forgiveness program to 30 years before you get forbearance, limiting loan forbearance, increasing the percentage of income that some people have to pay. So it's taking money out of people. And think about who this is hitting. This is hitting young families that maybe they got 2 jobs after going to college, a young couple, and they're trying to save for a home. And now all of a sudden their student loan costs, because these apply retroactively. People who borrowed money thinking they were going to have to pay under one program now have to pay higher amounts. So this is going to hurt their ability to get mortgages, hurt their ability to send their kid to preschool, to get maybe the extra tutoring that they need and things like that. It's going to hit young families really hard. Next slide, because the gutting science, we talked a little bit about this already, but the massive cuts to NIH, the energy sciences, the National Science Foundation, NASA, NOAA, National Institutes of Standards and Technologies, all these scientific institutions that fund medical research, key environmental awareness to try to figure out the weather programs and things like that. All these are getting gutted, and it's going to hurt. And you've all seen in the news where like China is recruiting scientists, Europe is recruiting scientists from the United States. So we're losing we used to attract the best and the brightest to do the cutting edge research that created things like the internet, that created, a lot of the medical treatments that have revolutionized. We're now sending our scientific talent away, and that's a tragedy, and it's going to hurt our children and our grandchildren. Next slide. FEMA. Yeah, this is nuts. I don't know how to say this nicely. And you saw in the newspaper today where they put on leave 180 top FEMA staff because they told the truth. So right before hurricane season, 180 key leaders are not working to prevent and mitigate damage from hurricanes. But they are cutting the FEMA budget for disaster assistance by $37 billion. And their solution is, let the states figure it out. So if we get a massive hurricane in your area, the Trump and Republicans are like, hey, we'll figure it out. Go figure it out. You're on your own, because that's the theme here, right? Think about yourself and think about the short term. That's what they want you to do.
We've had a lot of assistance from FEMA in this community in previous years, a tremendous amount. So if you were to look at the way they've helped us in the past and thought that could be gone, it's absolutely terrifying if we hadn't had their help during Matthew. So yeah, even though we're kind of complacent, we're geographically protected a little bit, we have taken a lot of help from FEMA in the past.
Yeah, and they actually help in some local, like the floodings, and I know it's not your area, but up in the mountains, they've helped with things like that. And here's the one that really, I think you've all heard on the news, the flooding in Texas that, killed where those children lost their life at the camp. And they actually are cutting $8 million to eliminate the flood hazard mapping and risk analysis program. I mean, that's their idea of efficiency. This makes no sense, because what that means, this is another unfunded mandate for Virginia, because if you take away the federal flood maps, Virginia is going to have to figure out how to do that, because if you don't have good flood maps, the insurers aren't going to provide flood insurance, because how are you going to know whether you're in the floodplain or not if you don't have a flood map? And the Republicans want to get rid of the flood maps for the federal level. It's also an efficiency thing because what they're saying is each state has to figure out their own flood map program. So they have to find the expertise, they have to buy the software, they have to do all this work. It is far more efficient to, there's economies of scale to do it at the national level rather than try to have each state figure this stuff out. And this, there's apparent, I'm not an expert in Hampton Roads. Maybe Kat, you can speak to this, but there has been funding cuts to Hampton Roads projects to mitigate disasters. That's been hitting you. Next slide. This is yours, Kat. The
Impact on Virginia Beach, funding cuts to Hampton Roads projects.
yeah.
BRIC launched under the Biden Infrastructure Investment and Jobs Act, awarded billions of dollars in grants nationwide for risk-reducing projects such as flood control systems. And this administration ended that program, rescinding funds that had not yet been spent, and that included nearly 25 million earmarked for Tidewater, and those improvements like the Lake Mead Dam in Portsmouth. So, and that's where you're talking about the Texas stuff, right? We're talking about, the potential for disaster in our area. The Hampton Roads Planning District Commission lost 200,000 that was set to help update the region's hazard mitigation plan.
Yeah, and this is getting replicated throughout the Commonwealth and throughout our country, and it's that their whole bet is none of this stuff matters, and I think we're going to find out, unfortunately, that it really does matter. Next slide. Let's talk about nutrition and food security real quick. So they are doing again, they do a lot of little things that not little things, but a lot of things that add up to serious problems. Like there's listed here a bunch of provisions that reduce SNAP funding. But basically what that's going to mean to Virginia in the budget, and this is something that's going to have to be dealt with during the General Assembly, is they're putting essentially a copay where Virginia is going to have to come up with probably $160 million for, quote, our share of the SNAP program, which currently we don't. And then they're also increasing the administrative costs. So it's going to be about $250 billion in $250 million in state money that will have to be found to keep the SNAP program whole. And that's going to be tough in this environment right now. Okay, next slide. So these are some statistics on SNAP and Virginia Beach. And the main point here is that SNAP helps a lot of Virginians, 830,000. And that's 32,000 people in your community. And many of them are children, 30% are children, adults with disabilities, seniors. And these people, because you know that Social Security does not provide a living income at the lower end. And that's it. It's 1.8 billion annually to Virginia's economy, and that has multiplier effects, what economists call multiplier effects, where that you spend some money in the store and then the store makes money and spends it and things like that. And it's very important to small grocery stores and farmers markets, especially in rural Virginia. I have a friend who lives in West Virginia, and where they have co-ops for Medicaid, SNAP-funded co-ops to help local farmers and poor people, and they're getting wiped out. It's really going to have an impact on the ability of people to get food. So that's going to put pressure on on food pantries and things like that. And this is kids not getting food. So this is really gut wrenching. Next slide. So in conclusion, next slide. We didn't go into foreign affairs because, it's a short time and we want to have some time for questions. But I do want to say that this is about the Republicans want you to think about numbers, specifically your numbers, your tax cut numbers. They don't want you to think about human beings. But let's remember, behind these numbers, when they say budget savings, there's a human being attached to that. And to me, the most gut-wrenching impacts is the USAID cuts, which we haven't talked too much about. But they're estimating that maybe as many as 100,000 children and adults mostly children, have already had impacts from this already. And Lancet set, the medical journal is saying up to 14 million people could die over the next 5 years because of the cuts to AID. And we need to go out and listen to people and hear their stories and share their stories. Now, I've given you more numbers than maybe I should have, but on the campaign trail, I'm sure you're going to meet people and hear from people, and we can listen to them and we can share their stories. That's part of what being a representative is all about. And I think we will do that better. And I'm very confident that 98, 99, I'm just calling you the numbers, sorry. And 98, 99, and 100 will do it better. And I know Abigail Spanberger will do it better than, Winston and her AR-15.
Winston. I love it.
Winston, I'm sorry.
No, I like the other.
So anyways, next slide. So again, to summarize, we're going to lose a lot of Medicaid revenue. There's cuts to nutrition programs. There's education cuts. There's FEMA and NOAA cuts. And the problem is we've done this in 45 minutes. We have not covered everything. I'm sure all of you are like, many of you are sitting here saying, well, what about this? And what about that? And what about that? Because there's a lot of things we just haven't had time to cover. And it's, so this is a serious issue. It's a serious challenge to us to do better. And anyways, next slide. So do you want to finish this up, Kat, or do you?
Okay, sure. Threats to Hampton Roads, healthcare, education, coastal safety, property, and jobs. Federal and Republican budget cuts are hurting everyday Virginians with increased costs and loss of vital services. Virginia Beach families need representatives who will address these problems proactively. And we need strong voices in Richmond to make sure our community's needs are represented. And these are very challenging problems. We'd love to be able to go to Richmond and say, I want to do this, and I want to do this, and I want to do this. But instead, we have to clean up what they've already done to us. So, we need to support locally based programs and solutions. We need to put our heads together, and we need to come up with creative ways to address this, because we do not want children starving on our watch. We do not want grandparents starving on our watch, and we need to protect Virginians. So what we can do, well, you can elect me and my friend Cheryl and my friend Liz, and talk to your friends, please. Share information, talk to your friends. This Zoom is going to be available if you want to watch it again and try and absorb what I know is very fast information going past you. And volunteer to help me, volunteer to help Liz and Cheryl, because it's mainly about us getting the word out, sharing these stories, and letting people know that we're the ones who are here to help. I mean, this is coming down the pike no matter what. It's coming at us. So we see it, and we're prepared for it, and we're already working on resolutions that will protect Virginians.
So do we have time for questions?
I think we want to give Liz and Cheryl an
sorry.
opportunity to speak. Liz, I know your time is shorter. Would you like to take the floor?
Sure, I can share for just a second. Thank you all so much for inviting us on here and for sharing that information. It's super important and is one of the primary reasons that I decided to run. So for those of you who don't know, I'm Liz. I'm running in District 100. And I am one of those people who lost my job earlier this year because of funding cuts. I was working for an organization that was funded by the USDA, specifically the Farm Service Agency, and our cooperative agreement stopped being paid. And so the organization I was working for had to do a round of layoffs, and I was caught up in that. But part of the story there is that I was serving as a farmer advocate. So one of the things I care about is making sure that our farmers are taken care of and that people have enough food to eat. But all of this, but I also served as an educator, and I've been a healthcare worker. And so literally every single one of those pockets of funding that we were just talking about has personally impacted me. I'm now working for the Coastal Research Center over here on the Eastern Shore. They're NSF funded, and so their funding has been in flux all year as well. And it really impacts almost every sector of our economy in District 100, whether you're a veteran, a farmer, a healthcare worker, an educator, a research scientist, somebody who works up at Wallops, our NASA center. So this is very personal to this district, and I think that this information is crucial to get out to folks. And there's a whole lot of people here that have similar stories to what we've been discussing, and it is very personal, and it is very serious. And I think that we deserve candidates who take it seriously, and my opponent is someone who hasn't had a lot of empathy for people that have been caught up in a lot of these cuts and the disasters that are coming. And so I'm running as somebody who is bringing an empathetic approach and who understands the issues and has experienced them on the ground, both in coastal Virginia, but also during my time in southwestern Virginia. So I'm excited to have more conversations about this and have these topics be brought up and discuss them more in depth and to talk more about what we can actually do at the General Assembly level to fix some of this mess. So thanks for letting me be here. I'll pass it to Cheryl. Thanks for your support. Thanks, Kat.
Hi, and I'm Cheryl Smith. I'm running in District 98. I am a retired teacher, and a lot of my time was spent in Title I schools. So I know, again, firsthand how the money, and it was always never enough money just for teachers, supplies, that kind of thing. But our students were coming in and, you know, their families are just struggling. And for me, if we're really going to help kids, we also have to help their families. We had kids that would come to school sick because they couldn't afford, you know, parents couldn't afford to take a day off work, or they just couldn't take them to a doctor. You know, prescriptions, they couldn't afford prescriptions for their children's shoes. And to me, it just hurts when you see these people really trying and they just can't get ahead. It's like everything is just always against them. The people I talk to now, as we're going around meeting people in neighborhoods, their biggest worry is the health care, because they're hearing, oh my gosh, what's going to happen? Are we going to be able to cover this? Am I going to be able to get prescriptions for it's hard enough now to get a doctor's appointment. I can't even imagine, you know, once we start losing facilities. And I guess in Virginia Beach, we might be a little luckier than some of our cities out, you know, in the country, the rural areas. They're really going to be hit hard. And I've just always been a people person, and that's why I'm running. I just want to help people help themselves. I mean, that's all they want. They just want an opportunity to help themselves, to have a good life, to be able to afford a decent place to live, food for their children, and even the seniors, just to be able to retire without having to struggle. So that's why I'm here. These facts are fantastic, and I would love if we were able to get copies of the slides, because sometimes while we're talking to people and we can bring these numbers in, it makes it more real for them. They can really kind of understand a little bit better. So thank you.
Thank you, Cheryl.
Yeah, appreciate all
Cheryl's
this.
a great candidate. Liz and Cheryl are great candidates. So if you have friends in 100 and in 98, please make sure that you tell your friends about Cheryl and Liz.
That there is a woman who was talking to one of our volunteers who was really concerned about her bipolar son, who without Medicaid help, she doesn't really know what she's going to do, and she's a single parent with 2 other children. So that's
I
a
mean,
story.
Medicaid, when kids have really serious problems like mental health problems or physical problems, for a lot of families, Medicaid's really, really, really important. And sometimes when I've had issues with substance abuse, and like a 19 or a 20-year-old can get on Medicaid and then they can get treatment, right? And I know from personal experience what rehab costs, because I had a son that we put through. And those programs won't be available for families. And like I was lucky, I had a home equity loan. I could take care of it because I'm, you know, fortunate. But a lot of families can't. And so people are going to be put in really harsh, tough situations, and it's just really cruel. I don't if the candidates want to chime in.
I think Liz had a comment about that.
Yeah, absolutely. I mean, I think that that's something that we're seeing in a lot of our conversations. I know I toured our rural healthcare system recently, and I've been in conversations with folks who work at our local hospital, and there's a lot of concern about that issue, not just Medicaid in the sense of the personal care and affordability, but also what it's going to do to our entire system and its ability to function from an economic standpoint, but also what does that mean if they start to have to cut services or practitioners? Like, I think most people are like, oh, I might lose my insurance. And I'm like, no, we might lose our entire facility. So it's going to go from like, oh, well, the impact isn't just your insurance will be more expensive or you won't have it. We might not be able to get the care, period, without having to travel hours to get to a facility. But then those facilities are also going to be overburdened because more people are going to be going to them. So anyway, it's the trickle down effects of this are going to be pretty substantial.
And it's
Yeah.
terrifying too in a city like Virginia Beach, where that's our only healthcare system. Centera is all we got. So, it's going to be, really keep an eye on what's happening with Centera.
Are there other questions that people would like to put in the chat and we can raise with the candidates?
Yeah, I'm putting one in now, or I can voice it if you prefer.
Go ahead, Joanne.
ACA starts November 1st, the new sign up for the year, which will have significant increases in everyone's premiums, unless Congress steps up and extends those tax credits. So it's important that people do get to their Congress people and fight for that so that we can get those increases taken away. And what they're also doing is they're taking away the time that you can sign up for ACA. It's the period has been limited by 1 month. It's shortened, and there's no automatic renewals anymore. So they're making it so difficult for people to even get the ACA that they're accustomed to. So I think that's something that you might want to let your constituents know, that that's coming up November 1st, and they might be, a rude awakening of what that's going to look like.
There's a question about impact of Medicare costs, Part B and D, and et cetera. I have not seen any direct changes to the Medicare program. They were not in this latest bill. They didn't touch Medicare, to my knowledge. I went through it pretty carefully. But again, it's a healthcare system, so the impacts on Medicaid, and they did do things because there are programs in Medicaid that support Medicare by paying co-pays and helping people get their Part B coverage, and those parts are being cut. And so there's some kind of indirect impacts, but I don't think they're changed. They haven't now by law, this is technical stuff. The reconciliation procedure you may have heard of is how they passed the big, beautiful bill without a filibuster. By law, they can't change Social Security through that provision, that thing. So they can't. The only way they can change Social Security is they would have to get Democratic votes in the Senate to do that, and I don't think that's going to happen. So Social Security is relatively safe as long as there's not 60 Republican senators, because they can block it. The next question is, can Virginia pass its own staffing regulations? I'm not an expert on Virginia law, but I don't see why not, but I would defer. I don't know. I'm not.
Well, that's something that I think she's talking about, that I've wanted to do, because we have issues already with safety in our care centers, and now we're looking at cuts that are going to further exacerbate that. Like, are we able to ensure that we're keeping people safe? I think is what Patricia's asking.
Well, I thought they did pass, at least for nursing care centers, I thought they did pass a minimum staffing, but then they cut their budget. Governor Youngkin cut the budget.
You mean for the state level?
For the state, yes. Isn't that what this is? Can Virginia pass its own minimums?
Yeah.
Yes. So I think they did something like that for nursing care. My parents are in nursing care, so I kind of been trying to keep up with that. So they did pass a minimum staffing, but then Youngkin cut that out of the budget or made big cuts to it. So now the nursing homes don't have the money to put the maximum, the people in there anyway. So it's like, yes, they're saying to the nursing homes, okay, you have to have this many people, but we're not going to give you the money to do it.
Yeah,
And then
and
the people that
I'm
oh, so go ahead.
sorry, I have my screen off because I'm packing and it's a disaster. But but um, I know the facility where my family member was. Sometimes the nurses' aides would have like 25, 30 people, like on a day or evening shift. That means they don't have time to help people eat, drink. We would go in sometimes one day, and because like she couldn't reach her water, we could tell she hadn't had water since we had been there the previous day. I mean, it's really important. And whatever the level is, it's obviously too low. And I know that we can't deal with the hedge funds that own the places right now, but yeah. Anyway, I'm kind of passionate about that because I've worked as an LPN in, I think, 7 states, and it is different in some. Virginia's not very good. So,
Yeah.
Thank you, Patty, for that. But yeah, I really do want to work on something like that. But I'm also concerned, and you guys want to talk this while you're talking to your friends, if they have family or parents in care centers, that we have a law here in Virginia, filial. Is that how you say it? Filial. And what that law states is that, if your parent is indigent and they need care or whatever, let's say they're getting evicted from the nursing home because Medicaid's not going to pay the bill, you're responsible. You are responsible for your parents, regardless of your relationship with them, regardless of your own financial situation. That we could be looking at parents coming home and maybe somebody with advanced Alzheimer's and a home that's not equipped for that. So there's so many nightmare scenarios that could happen out of this. And thank you for at least starting to, so we can get our head around it, Andy.
So there's a question for me about rescissions. So let's, and this is going to be a big, giant issue in the next few weeks, like in the next 3 to 5 weeks, as we try to get the 2026 budget appropriation bills passed. So the law is, I'm going to try to make it simple. The law states that when Congress appropriates money for a purpose, the president must spend the money. So when Congress appropriated money for a lot of these NIH programs that have been cut, for the DEI stuff that's been cut, for foreign aid, the president has a legal responsibility to spend the money to meet the intent of Congress, because it's the Congress that passes the appropriation and has the power of purse. This president, and that was done through something, and Congress, Nixon did a bunch of impoundments, and Congress in response passed something called the Impoundment Control Act in 1974. This president's OMB director, Russell Vought, says that the 1974 act is unconstitutional because, and I have to explain this a little bit, they believe in something called the unitary theory of the executive, which means the president has something called prerogative powers. Now, prerogative powers are the powers that kings have to do something unilaterally without constraint of the law. And they are literally asserting that the president has a prerogative power to not spend money passed by Congress. This is wild. They're going back and saying the president literally has powers of a king, which we had a revolution about that a couple 250 years ago. They're going back that far. And so what they're doing is, the concern here is that, okay, let's say we pass a bipartisan bill, like the Senate's trying to pass some bipartisan appropriation bills. Well, what does that mean if we all have an agreement bipartisan to spend money at NIH and all these good things, and the president, exercising his power of the king, decides not to spend the money? That's an undermining of a core legal principle embedded in our Constitution. It's literally, and I'm not making this up, they're trying to establish kingly powers in the United States. It's nuts. And so that's something we got to watch, because the other thing they've done is according to the law, you can, what they call a rescission. The president can submit a rescission package to Congress, because there's times when maybe the president recognizes, okay, we appropriated money, now we don't need it. So they did provide in law the provision for rescission. And the president, that's what you heard they did to NPR, where the president submits a rescission package, and then there's 45 days for Congress to act on it. And if Congress doesn't act, the president's required to spend the money. But what we found is I think it's 38 separate cases have been reported to GAO of impoundments, and the president didn't submit a rescission request. And so now we have this problem. What do you do about it? It's the end of the year, and all these fund months for like AID and NIH and all these, probably Farm Service Agency that Liz talked about, they have not been funded in accordance with law. What do you do about it? And there's a lot of technical legal things here, but this is a major crisis that if we cannot have the power of the purse, if we cannot have a president who follows appropriation law, this is a big deal. And it's hard to explain. It's technical, but basically it's whether we have a president who follows the law or whether we're subject to the whims of the guy in office. So we'll see how this plays out.
Thank you, Andy. Were there any other questions? I understand Joe did want to introduce himself. That's okay. Good, Joe, go ahead.
Yeah, hey guys. My name's Joe. I'm with an organization called America Saves Money. Our mission is to hold Jen Kiggins accountable for her vote on the budget bill. So what we want to do is make sure that the community knows that as they're losing their benefits, that they know that it's behind the budget bill. How we're doing that is we're sharing stories of people from around the community through video content that we're trying to capture, so people can get out there, how they're going to be impacted, how they feel about the bill, and also Jen Kiggins. So yeah, that's something that I'm doing. You can go to my website at americasavesmoney.com. I did have a follow-up question for Michelle, if she's still here. You mentioned that you were speaking with a mother that has a son that's has a disability. And I was wondering if you have their contact information and if maybe we could connect after this to see if we could connect.
I was reading the question, but I will let the question in the chat, I'll let that person, could you put your contact information in the chat?
Mm-hmm.
Yeah, we can, we'll let the person reach out.
It was me. And actually this person was, I just gotten out of the hospital. This person was my PT person that was assigned. I'm under Medicare, not Medicaid. But I can ask her. So if you put your information, that would be great.
I will put my information and I'll let you guys get going with your questions, but I'd like to network with anybody that wants to talk to me after this. Thank you.
That's great. Thank you very much.
Hey, there's a question Liz asked about whether it's 1 year money or multi-year money, and it's mostly 1 year money.
Thank you. That's that was my gut. That's what it'd be.
But there's probably some multi-year. I haven't gone through all
it's okay, but I thought it was primarily 1 year.
Okay. All right. Sounds like you're a budget person.
Yeah, was.
Okay.
Joanne?
Yes. Speaking of the bill coming up to fund the budget, I know Elizabeth Warren has come out and said she's going to demand that they reinstitute the Medicaid cuts as a demand in order to get a budget done. So I like that. I think that, I don't know how it will fly, but the Democrats have to stand up and really fight hard and fight fire with fire. And I think that, they have to do that once Labor Day, after Labor Day.
That's a tough one. And I'm gonna, because there's a couple things going on. First, it's important to note we've had a lot of shutdowns over the last 30, 40 years, but we've never had a shutdown caused by a Democrat filibuster. And that's what Elizabeth Warren's talking about doing, is filibustering the appropriation bills to stop them and shut the government down. That's never happened And if that happens, most of the people I talk to on the Hill who have Hill experience, who know this, thinks the Democrats will be blamed for shutting the government down, and it will be viewed as a Democratic shutdown. And as shutting down the government economy, the government could throw the nation into recession immediately if it extends for more than a couple weeks. And so this, and like in the spring, they were, everybody got mad at Schumer because he let the continuing resolution go by. The Republicans desperately wanted a shutdown. They wanted Schumer to block the appropriation bills because that would have put the country in recession, and it would have been a Democratic recession. So we have to be very careful about shutting down the government. Now, a more interesting thing that's happening is that Republican Susan Collins, chair of the appropriations bill, is putting bipartisan bills through the Congress. They're getting like 87 votes in the Senate. What we need to do is demand, and these are good bills. They would do what we need. And what we need to do is in the House, and I talked to James Walkinshaw about this, is we need to demand that the House Republicans bring these bills to a vote, because then if we have a shutdown, it's the Republicans shutting down the government. And that's what we have to be really careful that we don't get blamed for shutting the government down. And we also have to realize it's good to be talking tough and all that, but millions of people will be out of work. And we don't know. In the past, federal employees have been paid at the end after, a shutdown for 4 weeks. They've gotten their pay. We don't know that that's going to happen. And second of all, we have indications that the president will not shut the government down if there's a shutdown, that he will continue to fund the programs. He's kind of hinted at that, and Votes hinted at this, that if we shut the government down, they're just going to keep doing what they're going to do, and they're going to pay to do it. And then we're in a really bad place. So I hear what Senator Warren's saying, and I appreciate the sentiment, but this is a game of chess, and there's a lot of pieces going back and forth, and we got to be careful because shutting down the government, if it's blamed on the Democrats, could really backfire on us. And that may not be what you want to hear, but
Janelle, I think, has her hand up.
Yeah, I wanted to say a couple of things. First of all, thanks for doing this. And I see a lot of our folks on here because we think this is a message that we can carry forth, because Republicans really can't talk about this because they're the ones who are creating this mess. And so I think it's an opportunity for us to really take a hold of some white space by providing information to not just us, but people in our communities. They'd want to hear about this. And then I just want to say where our opportunity is as people on this phone is to really think about how do we talk about this to our community. And I think with what happened with Schumer the last time is he sort of started in one place and ended in another. And I think the opportunity is to let people know where you are. And the most important thing you can do is to have a quality why. If I'm going to do something, I need to not just have a why, but it should be a quality why, so people understand why I'm doing the thing that I'm doing, and then they can get behind you. So whether it's Senator Warren or whatever she's thinking, whatever decisions that they're going to make, it just should be a quality why behind it, and then get people behind you, understanding why you're doing what you're doing, and then finding the best ways that we can to inform our communities about what's happening and why we're doing what we're doing. And I think this call and us being educated on it is one of the best things we could do. So thank you all for this.
You, Fennell.